So thank you. I want to begin where we began yesterday by recalling Director Insel's comment that if untreated mental illness is associated with violence, and if alcohol and substance use services are associated with violence, and we have evidence based on what we've heard that they are, specifically in certain targeted ways, then there's a role for services, and services can work. And that's the programs piece of this. And there's a role for policies, and policies can change things. Financing policies, insurance policies, payment and reimbursement rates, the way delivery systems are organized. And I think that with regard to both services and policies, there's a role for understanding evidence. And I've heard quite a bit today about promising areas on the program side that we specifically need to target. And I think in particular, specific evidence-based programs related to alcohol use, substance use. We actually talked very little about the major increases in prescription drug abuse, heroin abuse. There are some programs specifically to those that are evidence-based. And from a program perspective, dissemination is really a critical piece. And I think that one thing that maybe we can all agree on this panel is that there is much less activity than we would like in getting those evidence-based programs, getting those evidence-based policies into broader practice. I'll tell you that an area that I've worked in is depression in primary care, and there are meta-analyses of meta-analyses. And still, places aren't using these very, very well evidence-based practices that even are shown to save money and increase value. So I think dissemination is critical here. With regard to policy, as I listened to Henrik Brown's presentation, I thought to myself, all of this applies to policy and policy evaluation, and we need to be using all of these same techniques with the same kinds of considerations with regard to the partnerships with communities that are impacted. So the role for policy and evaluation is enormous. And I wanted to note one thing that didn't come up as much as it should have, which is the role of evaluating unintended consequences of policies. And we heard about this just very briefly in the context of the law that was passed in New York State and the potential unintended consequence of this law related to inhibiting treatment seeking on the part of persons who are in need of treatment. And one way to try to implement and disseminate services and disseminate policies that we know work well is to create a financial incentive to do so. Pay for performance. And so I think that pay-for-performance models appropriately applied and without increasing problems related to potential adverse selection of populations that might be more costly and more difficult is critical. And I'll give the example briefly of the program that I've studied in Massachusetts. This is an accountable care organization, 64 different performance measures, one of 64 related to the population of individuals with mental health and substance abuse disorders. And surprise, surprise, very little in the way of accountable care and system change with regard to those systems of care. And finally, the issue of sustainability is critical. And here is where financing and insurance changes can make a difference as well. Thank you, I'm done. I'm ahead of schedule. There you go.
Thanks, Colleen. Thanks very much. And I think